Welcome to Medicraft's BDS Express short concept discussion, and in today's class we'll be discussing one of the very short and sweet topic, and that is effect of drugs on fetus. Now this is the pharma topic, but this topic can be asked in your community medicine, oral pathology as well. Now, before starting, let me tell you that if you have not subscribed to our YouTube channel, please do subscribe it and press the bell icon so that whenever we update any new video, you'll automatically get updated. So let's start with the topic effect of drug in fetus or in fetus, you can say. Now there are certain drugs which can cross the placental barrier. Now let's say, for example, tetracyclines. Now, if you prescribe tetracyclines to the pregnant females while they come to you for anything, and you just prescribe tetracycline without knowing that this patient is pregnant, or this patient does not give you history of obstetrical history, what will happen? These tetracycline, they tend to discolor the teeth. Okay, discoloration. So this discoloration of the teeth will be there after the birth in the child. Yellowish brown discoloration. So that's why few drugs, they are important to learn, as they can affect the fetus if you give them to the pregnant females. Now, first is the drugs if you give from conception to 17 days of pregnancy, then it can affect the fertilization and implantation, and eventually it will lead to miscarriage or abortion, you can say. So failure of pregnancy, which often goes unnoticed. Okay, so you can say missed abortion or threatened abortion, whatever it is. So if any drug you ask patient to take, and patient also don't know that whether she has conceived or not, and this drug, it crosses the placental barrier within the conception to 17 days, then it can affect the fertilization and the implantation. Next, if you are giving any drug from 18 to 55 days of gestation, almost 2 months, and this is the most sensitive period, that is organogenesis is taking place in this period. That's why it is advised that you're not supposed to take radio postings if you are expecting, right? In the first 3 months, or you can say the first trimester, in the first trimester, you should avoid the radiations, the medicines and everything, because organogenesis is taking place in this period. So if at all you are giving any drug and it crosses the placental barrier, what will happen? This is the most vulnerable period, and deformities, they are produced. Like, say for example, C-limb deformities like thalidomide. So let me tell you, these two drugs, they are really important for your viva in pharma as well, in oral medicine as well, or you can say even community as well. So examiner can ask you which drug, if at all it is given during pregnancy, it can cause C-limbs. So the answer is thalidomide, right? Thalidomide is a drug which eventually is responsible for C-limb deformity in the children. Then second is the tetracycline. If at all you are giving tetracycline to your patients, to the pregnant females, what will happen? The child, they will be having discoloration of the teeth, brownish, yellowish brown teeth will be there of the children. So this is the second thing. First is from conception to 17 days of pregnancy. Second is 18 to 55 days of gestation, you can say, for 2 months. Estimating to 2 months, or you can say the first trimester. Now first trimester is really important because organogenesis is taking place. Then next is the 56 days onwards. After first trimester, if you are giving any drug and if at all it is crossing the placental barrier, then it will affect the growth and development of the fetus. So developmental and the functional abnormalities can occur. Now, say for example, ACE inhibitors, they can cause hypoplasia of the organ if at all they are given to the pregnant females. Okay, so this was all about the effect of drugs on fetus. if at all you are giving any drug from conception to 17 days, from 18 to 55 days, and 56 days onwards, that is first trimester onwards. So this topic, it is really important for viva, and question can be formed based on this thing only, that if at all you are giving any drug from this period to this period, what are the chances, and what phase exactly it is, like organ development phase is there, fertilization, implantation phase is there, or organogenesis phase is there. So this was all about the thing. And again, I'm reminding, if you have not subscribed to our YouTube channel, please do subscribe it and press the bell icon. And apart from that, we are also providing WhatsApp updates on through your WhatsApp. So you can just directly go to this link, www.medico, this is medico, co, medicoapps.org/groups. Here we are just providing update, and this is limited. So guys, again, I'm writing this medico app. Sometimes my pen does not coincide with the thing, so extremely sorry for that. So you can just go to this link and you can just join the WhatsApp group. Hope you have liked the class. Thank you.